Tonight, after nearly a year and a half of talks, nurses at Maine Medical Center have the first contract under their new union.
It has been a long path with a lot of twists and turns along the way. In April, more than 100 nurses picketed, pushing the hospital to move faster in negotiations. And just last month, the union survived a decertification vote with a 74% of members voting to keep the union. Good evening and welcome to NewsCenter Maine at 5:30. I'm Chris Costa.
And I'm Zach Blanchard. Thanks for joining us tonight. The Maine State Nurses Association union officially formed in April of this year, and now it has a tentative deal with hospital leaders.
Nurses say it will make for a healthier work environment.
We were planning an all-nighter.
After more than 30 bargaining sessions and 2 sticking points, leadership at Maine Medical Center and nurses in the union bargaining unit have reached a deal.
The center of this is for us to be able to take care of our patients and feel good about taking care of our patients.
Jonica Frank is a circulating nurse in the operating room and a member of the bargaining team. She says 2 items took the most negotiation. The first was increasing wages, including a 7% bump in the first year of the contract.
This is the foundation. We have literally laid the foundation for years and years of job security and patient safety here at this hospital.
The second is union security, requiring all nurses to pay a member fee or a partial service fee because the union legally must represent all nurses.
You're still guaranteed those services. We're going to fight for you, whether you wanted us here or not. In your time of need, we're going to stand behind you and we're going to fight for you.
She says the contract creates several workplace safety valves, like an independent professional practice committee to deal with patient safety and nurse practice issues, and ending the practice of mandatory rotating shifts, where nurses are forced to work day shifts on some weeks and night shifts on others.
We did this because we want to take care of our patients.
Frank says if nurses ratify this contract, they would not strike unless hospital leaders violate the contract.
We're not just walking away from some steel that is going to be there when we come back, whenever our strike is over. These are patients, so we feel that it hurts us. And so if we were ever to think about a strike, it's serious and it takes a lot of thought and contemplation.
Now, in a statement, Maine Medical Center's chief nursing officer wrote, Maine Medical Center is pleased to arrive at a tentative contract agreement with the union representing nurses at its Bramhall, Brighton, and Scarborough campuses. We're looking forward to a quick ratification by members of the bargaining unit. That vote is scheduled to happen next week.